يعطيكم ألف عافية جميعا ويا أهلا وسهلا. Hello for all our healthcare providers and practitioners. I hope you can hear me clearly. Jihan, if you can.
أهلا مسمحة. أيوة سامعينك.
First of all, we would like to thank you for all of your dedication. We are here for you. We are gathering today and gathering different specialties to cover all of your needs, starting from the scientific based information that you need to maintain a good well-being status or mental health status, to the mental health maintenance in terms of psychological management. Today, we are proud to have Dr. Leila Al-Auda and we have Dr. Thamer Al-Khashan. They will share with us a lot of great info that I'm sure by the end of this speech will influence your anxiety level tremendously. I want to share this first slide by Dr. Leila. And we all loved it because it combines all kinds of coping strategies or behavioral adaptation followed by the crisis, combining the correct and the healthy and the unhealthy coping strategies. Dr. Leila will have a talk about this later on. In terms of prevention and infection control, but we wanted to look at what's going on and how does it actually look like for most of us at the meantime and at this phase of the crisis. We are full of questions, we are full of coping styles and information and different level of knowledge that some of them are not scientific. So we want to ensure by the end of this speech, you will have all evidence-based information related to infection control and the infectious disease as well, and the mental health part. We will start with preparing you how to face this pandemic. We will start with preparing you scientifically and psychologically. Our first speaker will be Dr. Thamer. And Dr. Thamer, I wanted to start talking to you and sharing with you something from my personal clinical experience. Since the crisis have started, I chose to work with the frontliners to be able to help them psychologically by identifying their stressors. So we can plan for each group what fits for them, because we know it's not a one-size-fits-all solution. And one of the most struggling moments for me as a mental health practitioner was not being able to answer some common question related to infection control. Most of people in almost every single activity have asked me about this virus. Is coronavirus droplet or airborne? So I would love for you to give us some education about that and have the audience learn about it from the scientific side. Are you ready, Dr. Thamer?
Yes, thank you very much.
Thank you.
Thank you very much, Dr. Maha, for the nice introduction, and thank you all for being here. مساء الخير جميعا وكل عام وانتم بخير ورمضان كريم إن شاء الله يا رب علينا وعليكم. So I would like to start by so my part is going to be talking about so I can't share the screen while you're recording. So anyway, my part is going to talk about the airborne versus droplet, as well as the numbers, if the numbers are increasing. So yeah, okay, perfect. So I'm just going to share the screen. Do you see the screen?
Yes.
Okay, perfect. Okay, so my part is going to talk about the airborne versus droplet, and should we worry about the increasing numbers that we're hearing. So to start with, I just would like to refresh your memory about the types of transmission. I'm sure you're all aware of it. We have three types of transmission: that the infectious pathogen or infectious organism gets transmitted, or diseases, if we can say, gets transmitted through those mechanisms. So it's either contact, which is by direct contact, direct touching of the patient, or by droplet, which is the close proximity to the patient, whereas the droplet of that patient is gonna reach your respiratory system. And the third one is the airborne. And I'm hearing a lot of confusion about droplet versus airborne, and people are calling it air. Does it get transmitted through air or not? And we're gonna learn that inshallah in the next few minutes. So airborne is basically a type of transmission. It's not through air. Even droplet, it goes through air, but the airborne is a special type of transmission that we're gonna learn in details in the next few minutes. So this is a picture, if you can see it. So this is when someone coughs, he's gonna release some droplets, or even sometimes even if he talks, he's gonna release some droplets to the surrounders. So the surrounders, if those droplets are small, they're gonna travel far away and they're gonna be hanged in the air, and that's what we call airborne. And they are a bit large. I mean, we're talking about relatively large. You know, if they're like more than 5 nanometers, so they're gonna travel a very short distance. We call it like 1.5 meters تقريبا, and then it's gonna fall down and on the object. So this is the droplet. If the distance is small, we're talking about less than 2 meters or less than 1.5 meters, 3 feet, then this is a droplet transmission. If the particles stays in the air for some time, then they can even travel through the ventilation system or whatever. This is what we call airborne. Diseases differs in terms of their capability of transmission through droplets versus airborne. And up to the knowledge that we know so far, the COVID-19 follows the droplet isolation or the droplet transmission pattern, except in certain settings that we're going to talk about in detail. Dr. Leila is going to cover it in detail. So currently, the disease transmits through droplets. And the next slide is going to probably clarify this very clear. So you can see here that the big particles, this is droplet transmission. If they're large, they're just gonna, so people who are surrounding that infected person within 2 meters or 1.5 meters, they might get infected. Whereas in the airborne, which is the distant guy here, they might get infected sharing the room or even sharing another room if the ventilation system is unified. So this is the difference between airborne and droplet. We hear like lots of people talking about air. Yes, both of them, they're going through air, but airborne is when they hang around in the air for some time. So how to differentiate, how to know if the disease is transmitted through airborne or droplet? Basically, we can judge it in two ways. The first one is by doing experiments and seeing how large is the particle, and then seeing if it stays in the air for some time. But this has to be done in the regular setting, like the usual setting. Unfortunately, most of the papers that have come out already, so maybe you're aware of the New England Journal of Medicine, they're doing it in an artificial setting. So they're doing it in a lab setting, and they're counting the air, the particles in the air. But that's not the usual setting that we're facing day to day. So that's probably one of the caveats, or one of the problems of those papers that comes out. And again, as I said, we learn day by day about the new disease, the new COVID-19. However, up to now, there's no evidence to suggest that it's transmitted through airborne. Mostly it's by droplets. The second way that we can judge the disease, if it's airborne or droplet, is basically by knowing the infectivity. We have something that we call the R naught value. sorry, it's not, yeah. So the R naught value or the R0 value is basically in simple, I don't want to make it sophisticated, but in simple is how many each infected person would infect. So if someone infects one only, the R naught is going to be 1. If someone infects 10, the R naught value is going to be 10. So you can see here that is as of March 2020 that the COVID-19 infects 2.3 or 2.5. So each one infected person would infect 2.5. I know that the numbers are getting, because we're still in the pandemic, so the numbers might change, and they have already changed. So they're now becoming higher and higher. But keep in mind that in airborne transmission, the numbers are extremely high. You can see the measles here down there in the right corner, the right lower corner. You can see the measles. So it ranges from 12 to 18. So that's an airborne transmission. If the number of infected people around the infected index case is high, that is an indication that this might be an airborne. That's not by itself alone to say that this is airborne, but that's an indication to say that this is airborne. So the number for COVID-19 is still like, there's one paper that came out that says that it ranges, it can reach up to 5, but still we're learning every day. But up to this moment, there's no evidence to suggest that this is an airborne transmission. So it's droplet transmission, and you're going to learn in details with Dr. Leila what exactly you should do with droplet and what you should do with airborne, or how to protect yourself if the disease is droplet, which is the case in our new virus. So the last thing that I wanted to cover is the numbers. So I'm sure you all are following the numbers very closely to see what is the trend worldwide and what is the trend in Saudi Arabia. So the numbers are, again, it's good to have the numbers and know about them. However, they can be sometimes misleading. So we used to know, or we used to like probably understand that whenever the numbers goes up, it means that the problem is increasing. That is true sometimes, but sometimes it is an indication of something else. Let me just put it like very simple and precise. The more you look, the more you're gonna find. And in case of an infectious disease, this is really good because you're identifying people and you're dealing with them, isolating them, and even doing the contact tracing part, which is knowing who have contacted this index case, and this is gonna be helpful. If you can see, so countries here in this figure, I know it's a busy slide, sorry, but you can see the countries that have a very high testing rate in the last, second to last column. You can see that the number of countries who are having very high testing, they're picking more and their numbers are high. So for instance, if you can see Saudi Arabia, again, third to the last down there, third to the last row, you can see we're reaching 20,000 cases, but we're testing, and this number is not really updated, the 200,000. It's much more right now. I think it's probably approaching 300,000, but we haven't yet heard an announcement. However, for Sweden, for instance, which is down there, you can see they have almost a similar number to us, but they have tested less numbers. And so if you compare their deaths rate, so the death is more like reasonable indicator. So you can see that their deaths is much higher than us. So we're having 152 deaths compared to them, where they're having 2,355 deaths. So you can see here that probably they're not testing more. They're only testing sick people who came to the hospital. So this is selection bias, we call it. So we're aware of the sick people only. Most of the cases that we're picking so far is basically having mild symptoms. For us in Saudi Arabia, they're having mild symptoms, or even some of them are asymptomatic since the ministry have started the mass screening. So some of them are even having no symptoms, but they're picked up. And that's an important thing to point out. So if you see the recovery number in general, the recovery numbers per definition of all the health authorities everywhere, they report recovery if somebody viral or somebody PCR test or somebody test becomes negative, or he turned out to be negative. So that does not mean that the other people who are not recovered, they are critically ill or even ill or admitted. Maybe most of them are having mild symptoms, or some of them even having no symptoms at all. From my personal experience, like sometimes we call even people and saying that you have a positive test, but I don't have anything. Well, why are you saying positive? Can you repeat it? You know, so they're even doubtful about the diagnosis because they don't have symptoms. Their perception is, if you have COVID-19, you have to be critically ill and you have to be sick. That's not usually the case. Yes, we do have critical ill people. So out of our 20,000 people, we have only 118 people who are critically ill in the ICU. So that's another indicator that you should look at when you look at the numbers. So in short, again, the more testing that you do, the better control of the spread and the more cases that you're going to find, which is a good thing. Yes, the number going up, but we're picking the virus and dealing with it and preventing the spread. So I hope this clarifies these two questions that I intended to cover. And maybe probably we'll have the questions at the end. Dr. Raha, if you want to take over.
يعطيك العافية دكتور. في عندنا بعض الأسئلة إذا حابب if you like to pick some questions yourself, feel free. I've got one asking about which route of transmission you think is most severe.
Sorry, which route of transmission is most likely what?
Severe.
Severe, yeah. So it's clear that airborne transmission is the most. Again, we don't talk about severity when we talk about transmission. We talk about the likelihood of spread. So airborne transmission is more likely to spread to others because it stays there in the air for some time and it might get transmitted through the ventilation system. However, there are precautions for the healthcare workers. That's why the precautions are different for airborne and for droplet, and that's going to be covered in details when Dr. Maha talks about, Dr. Layla, sorry, talks about the details about personal protective equipment. Remember that it's droplets. However, when you do certain procedures, you do have to convert it to airborne precautions and wear the N95 and the details that Dr. Maha is going to cover. Dr. Layla, I'm sorry.
And there's one question also, Dr. Samer, you've said that there's some circumstances that the droplet would become airborne. Under what circumstances could the virus become an airborne? What are we talking about? Specific procedures?
Yes. So there is, again, it's not becoming airborne, but we tend to protect ourselves as healthcare workers as if it's airborne, because this procedure will generate aerosols. We call it like procedures like intubation, like bronchoscopy, like suction. Those are a set of procedures. We call them AGP. Dr. Layla is going to cover them in details. However, if you perform those procedures on a COVID-19 patient, yes, you have to wear the airborne precautions, definitely, and it has to be conducted in a negative pressure room. However, in the general, like dealing with patients and that, you have to follow the droplet precautions as far as we know for now. That might change, but for now, this is the thing. And I doubt it will change because the numbers are going to be much different. Yani, if we have an airborne transmission for such a virus, you would expect like the R0 value or the transmission is going to be like tremendous. Like one person might infect like 10 or more than that. So that's not the case. Yes, the cycle goes on. Yani one person might lead to more transmission because he infects someone, that someone would infect someone, but the person himself, how much does he infect? This is what we call the R0 value.
Thank you, Dr. Thamer. I think we have 1 minute left, and there is one question, sorry. What is your thoughts about the numbers so far?
So yeah, that's again a very good question, and we're hearing like lots of predictions and lots of ideas about where are we heading and is it going to be improving or not. Again, it's all prediction and it's all guessing. There are some scientific way of doing it, which by modeling, and the ministry have done that already to expect how much numbers can we or where are we going. However, there are lots of factors that will affect this prediction, i.e. if people like, let's say now, forget about this social distancing and they just like live their life normal and they think that the curfew that was a bit loosened which means that the corona is over, so they're gonna go back to their usual life. That is definitely gonna affect the numbers in 10 days or 14 days time, because this is the time when we're gonna hear about what happens right now. So let's remember that whatever number you're seeing, this is a reflection of what happened 10 or a week ago. So that is important. These are the factors that will affect the numbers. And again, you can't really predict because it's a human behavior and you have to know how people are behaving.
Thank you so much. I think our time is up, and thank you so much, Dr. Thamer, for the lovely speech. Dr. Thamer will be able to answer more and a lot of questions by the end of this webinar. Now we will have Dr. Leila Elauda. She will talk to us about the guidelines of prevention and protection for health practitioners and their families. So the mic is yours.
Assalamu alaikum. Thank you so much, Ms. Maha, for this. And assalamu alaikum jami'an wa Ramadan kareem wa alaikum. So as we started earlier, we talked about the horrific scenes that everybody's used to and the numbers that are actually concerning every watcher of the news, and all these symptoms and signs that are really giving you the sense that the world is going to end. However, this is not what we're actually facing in the front line, and this is not actually what we're doing. I'm talking to you as a practitioner that I've been seeing patients with COVID-19, whether pediatrics or adults, and I feel that it's our duty to make sure that we give you the appropriate image, because eventually if you're stuck in the cycle of understanding everything is going to collapse, you're eventually going to collapse, and this is actually what we're trying not to get to. Because eventually this is a disease, and this is an infectious disease that we are capable of dealing with once we understand the mechanistics and scientific transmission. And as we learn along the way, probably you heard a lot about the R0 and the transmission from Dr. Thamer. So what I want to do now is actually just break down things to you in a simple, systemic way. And just remind you that this is just another infectious disease that you can deal with if you're prepared. So the reason of your anxiety may just ameliorate if you just understand that this is not more contagious than chickenpox. This is not more contagious than tuberculosis. This is not more contagious than measles. If you were able to go in and see these patients and serve them, you definitely can do and serve a patient with COVID-19. So eventually prevention is what we are looking for, because if you follow the steps that we are going to tell you, or what all the authorities in the world scientifically are telling you, your chances of getting infected is very, very low. So what we hope by the end of this talk is that you actually say that, yes, I am ready, yes, I can go to work, and yes, I can live my life while living in this pandemic and be a proud frontliner. So going in, just want to make sure that we lay out the general concepts of infection prevention while facing this pandemic. First of all, this is a new disease. And whenever there is a new disease that people are trying to understand and trying to actually figure out the mode of transmission, they always start with like imagining the worst case scenario. And when that's the case, and when you just have the test ability to test the DNA of the virus, of course you're going to test it on any surface. And of course, you're going to test it on any particle of the air that you get it. But does this really mean that this disease is capable for transmission if I found a piece of it on a table or a piece of it on whatever material is? So this is where we really need to be rational and go back to our scientific basis and try to understand really how this disease is affecting our societies. So for general concepts, the main thing that we need to do dealing with a new disease is minimize the chance of exposure. And this is what everybody was calling for: social distancing, universal source control. When they say universal masking, meaning the patient and the provider wear masks, at least if anybody has been a silent carrier or a person who's actually having low symptoms but doesn't think that he has the disease, may unexpectedly transmit the disease. By doing so, you can prevent the disease from happening. The other thing is frequent surface decontamination. This is what we all have been seeing in our healthcare facilities, from frequent disinfection, and this is what we call for. So this is kind of the first concept. The second concept is that if we tell you adhere and do standard and transmission-based precautions, do them. If you are not doing them correctly, if you're not doing proper hand hygiene correctly, if you don't know how to wear the gown and glove and mask and eye protection and so on and so forth, and you don't know how to remove it appropriately to prevent self-contamination after you've been in a room of a patient with COVID-19, absolutely you'll have a risk of infection. But once you know, once you've been trained, and once you get to the bottom line of how this skill can be practiced and repeatedly done without any mistakes, your chances are very, very, very slim to get the disease. And then you need to know how to properly dispose and disinfect and maintain these personal protective equipment. And eventually these are manufactured materials, so they do have some limitations based on where they are from. So if you understand their limitations and prevent yourself from being in a situation where these limitations have faults, again, you're not going to have a risk for infection. And finally, you need to actively monitor your symptoms. And if you are a healthcare provider and you developed even mild symptoms, it's your responsibility to not report to work and not to present an additional threat to your colleagues and your patients. So this is, again, one of your responsibilities. So as Dr. Thamer mentioned about the differences between droplet and airborne, this is kind of different image of what he demonstrated about the droplet precautions, transmission mode, is that when the particulates in the air transmit in a fashion that they can stuck in the air even in a very far distance. This is when you say this is a long-range airborne route transmission or transmission via aerosols. But for COVID-19, it's more or less a droplet-borne, and these particulates also can land on surfaces. And that's the main reason where we say that the appropriate personal protective equipment for this disease is to apply the contact and eye protection and some sort of facial coverage, whether it's with the N95 respirator or the face mask. Now, I want to break down another definition for you. Now, you've been hearing a lot the term airborne. The term airborne means that you need to be in a room with a different ventilator system that is filtering the air in a negative pressure way, so nothing from the patient goes outside the room if the door is opened, and that air has been filtered in a way that it's not recycled into the room. Another way that people always understand airborne is by the type of the mask that they wear. So there are different types of masks, as you probably know by now. So there are the N95 respirator or respirators that are able to filter about 95% of the particulates in the air. And then there's the surgical mask or the regular face mask. The difference between the two is obviously the thickness and the ability to filter the particles of the air. And the N95 has the better ability to do that. So in any new pandemic or in any new disease, the same way we worked with MERS, the same way we worked with SARS, the same way we worked with Ebola. So when we don't know what we're dealing with, the overall impression is that we need to wear the N95 because this is a new disease and we don't know what we're dealing with. So it doesn't mean that you wear the N95 mask that you're applying airborne precautions per se, if you are in an open room or if you are in the open air. So the mask itself is what filtering air to you, rather than the actual transmission base of the virus itself. So this is what you're protecting yourself. And there has been some reports also about the possibility of you infecting yourself if you touch a surface and then touch your eyes, or if there was a splash on your eyes. So that's where it comes, the face mask or a face shield or the goggle, where you need to protect these mucous membranes in a way that you don't touch your face or you don't touch your eyes to protect you. So the ideal preferred PPE, or the personal protective equipment, is for you to wear face shield, the N95 respirator, and the non-sterile gown and a non-sterile glove, and that's it. You don't need to wear this whole big suit that you've seen all way through the media everywhere in the ICUs, except if you are going into a whole complete shift where you're going to take care of multiple patients with COVID-19. If you're just going to see a patient one at a time, this is what you need to be wearing, and that's it. If there's no N95 or the respirator is not available, and you're not going to do one of the procedures that I'm going to talk about in a minute, wearing a face mask, a regular face mask, is actually an acceptable alternative. And this is very important for you to decipher and to think about more cautiously, because if the N95 is not available, it's not the end of the world. We will not be able to have a consistent supply if this pandemic continues. Yet, there's a lot of parts of the world they don't have N95s, and these parts of the world also don't have continued transmission. So this is what the algorithm that most of the health authorities have been calling for, that in the conventional setting, if you're not performing the aerosol generating procedures, the N95 or the surgical mask is what is recommended. And for the aerosol generating procedures, the N95 and the N95 is recommended. So what are these aerosol generating procedures? So these are procedures that are likely to generate higher concentration of infectious respiratory aerosols, more than if a patient or a child coughs in your face, sneeze, or talk, or breathe. And this is when it's potentially put this healthcare worker at a risk for pathogen exposure. These are very specific procedures, like if you're open suctioning the airways, if you're inducing sputum for a sample, or you're doing resuscitation for CPR, or endotracheal intubation, extubation, non-invasive ventilation, bronchoscopy, manual ventilations. These are the procedures where the likelihood that the aerosols generated into your face, being so proximate of the patient, are more than what the usual interaction would be. Some also argue that providing nebulizer medications or delivering high flow oxygen is one of these procedures. However, data in that aspect is limited. So when you are doing such procedures, these are where you really need to wear that thick filtering N95 or N99 or respirator. And this is majority of the incidents that you are dealing with in the frontline, in the emergency room, in the EMS personnel. And that's where you find them wearing all these devices and machines because they don't know when they will be able, when they need to do that. So, however, if you're just entering in the exam room, examining a patient, taking history from a patient, or auscultating their chest, this is not what you should be worried about, because this is not what's going to happen beyond the regular aerosol that from coughing or sneezing or talking. So these are the N95 respirators.
باقي تقريبا 1 minute. Do you need more time?
Probably 3.
Okay.
All right. So just going through the types of N95 respirators, as you know, they come in different sizes and shapes because people have different contours, and the whole idea is that they need to seal to their to your mouth and nose area. So it depends on your face size and shape. This will vary. So you need to have a special fit testing that make sure that you don't have leaking of the air that goes from outside to your area of the nose and the mouth. And if you don't fit test to any of these sizes, or the size is not available, or you have a facial hair that allows air to come below the skin to your mucous membranes, then the alternative is the powered air purifying respirator, or the PAPR. And this is the machine that you see most of the people wearing if they don't fit in any N95 or the N95 is not available. And we prefer to keep these machines for the frontliners, the EMS, the ICU and emergency room personnel, so because they are of a limited stock. Now, what I want to emphasize in the last 2 minutes is that as much as understanding what to wear, understanding how to wear and how to remove it is actually as important. So I just want to make sure that you all understand this terminology of donning. Don means to put on, and doffing is to do off, or to put off. And there is a significant important sequence in how you wear the PPE. So for donning, you start with the gown and you fasten the ties very well. Then you wear the mask, and you put the mask in a special way that the upper strap is on the middle of your head and the lower strap below your neck. And when you wear the N95, you perform a fit check. And then you put the facial shields, and then the mask, the gown, the glove, and you make sure that the glove is covering the cuff of the gown. And as much as all of this is important, performing hand hygiene before doing so is as important, because when you remove the personal protective equipment, this is where you risk the possibility of infecting yourself. If you don't remove it in a proper way, if you don't remove it in a special sequence, this is where you may self-contaminate. So what's advised is that you keep the respirator or the mask and remove the PPE at the doorway or the entry room of the patient's room, and then start with the glove upside down and not to touch it, discard it immediately, then their face shields, and then your gown, and finally your mask, and then don't touch the front of the mask and immediately discard it and perform hand hygiene. This is another way of how to actually wear the N95. And importantly, these are very important ways of not wearing the mask, not to exposing your nose and not leaving your chin exposed and not having it loose, and not exposing part of your nose and not letting it hang below your neck. So the proper way of wearing a mask is that you cover most of your nose and your chin and have it tightly wrapped all around your face. Finally, I want to end with this about how you can keep COVID-19 out of your home. So it's very interesting how this came only along with COVID-19, but this is also like, these are common sense practices that all of us need to adhere with in any when you deal with any infectious disease, let alone like multi-drug resistant organisms or MRSA or even other organisms. So what's the major advice that we are saying, particularly in our institutions, is to make a hot zone at your entrance of your personal living space, where you can keep a rack, a hamper, or a bath and a hand sanitizer and some wipes. So once you enter the house and you're done with your job at work, you just hang your clothes, you disinfect your personal belongings, especially your mobile devices, and immediately wash your hands before you encounter your kids. So what I always also say, that if you have a spouse, just make sure that the kids don't run into you at the entrance of the door until you finish all these procedures, because eventually this is common sense that this is what we have to do in all infections and not just with COVID-19. I think I'll end it here. Smeha.
Thank you so much for the wonderful speech, Dr. Leila. I'm very happy, and I'll show why later on when I talk about the psychological part. But I think there is a question related to your speech, if you don't mind us going through them, a couple of them.
Sure.
There was a question about the difference between the surgical mask and the N95 mask.
So as I alluded to earlier, the surgical mask is just a loose cover that you fit over your face that is able to prevent any splashes or sprays from the patient excreta, whatever it is, to enter to your mucous membranes. And it doesn't filter a lot of the particulate matter. So it doesn't really, it's kind of like a physical cover, more or less, with some filtration ability, while the N95 is a more sophisticated filter where it's able to filter about 95% of the particulates in the air. So if there's a small virus or any microorganism, that would be filtered through the N95. Now, the idea of the N95 is not just about the structure of the mask itself, it's also how it's fit to your face. So how you are properly sealing it and having it tight over your nasal bridge and covering all the nose and the mouth. So that's why it comes in different sizes and shapes, and that's why I've been hearing a lot about the need for removal of facial hair, because that's where the things go below the hair inside to the mask. So that's where the main difference is. So I would say the surgical mask is loose fitting as compared to the N95, which is actually having a very fit seal, and the surgical mask is more kind of like general protection, and N95 is more protection, but it's not needed for every single visit the patient to wear the N95.
Regarding the N95, Dr. Leila, correct me if I'm wrong, but what I'm hearing, it's not a one-size-fits-all, and I think each organization should have tested the correct size for their employees. And it is important for the healthcare providers knowing their correct brand and size and all of that, correct?
Yep. So most of the institutions at employment or at some point, even during early in this pandemic, called for N95 fit testing. And yep. You can be either objectively or subjectively. So there's these devices. I don't know. Do you see my slides right now?
Yeah.
So the upper picture shows the device where it's measuring the pressure of the air going into the masking of any leakage in there. So it's kind of like an objective test. While the lower picture is the old-fashioned way of how to do this by spraying a material that you can actually taste. So if it actually traversed the mask and went inside and you were able to taste it or smell it. So it tells you that you failed the test because the aerosol was able to transpass the mask. So this is what the whole idea of the mask fit testing. So once you know your size, you need to make sure that you wear that specific size if you need to. Otherwise, it's going to be not really protective.
Wonderful. By talking about HEPA filters or filters in general, there is a question about HEPA filters, and the question is HEPA filter enough in a room where there is a corona patient?
So as we talked earlier, again, I need to disclose that I'm not infection control, but there is a difference between infection control and infectious disease. But in general, the idea of airborne precautions is that you need the air to circulate out and not back to the patient room. And there is a cycle in the filtration system in a negative pressure room that is ideal for airborne setting. Now, if you don't have that negative pressure, the alternative is to have a HEPA filtration or these devices that can circulate the air and clear it out immediately. Now, if that's not, so it comes like a second tier of the preferable way of creating a negative pressure room. And this setup is maybe, I would say, advisable to do in ICU settings, in settings where you're going to do a lot of aerosol generating procedures, and in settings where patients are in high nasal cannula, or they are exposed to open suctioning. So whenever the air that you generate in the room is higher than what we talked about, so any procedure that requires that, having a HEPA filter in a single room is actually advised. However, it's all subject to availability. Like if it's not available, it's not available. So we cannot do much about it. But this is the recommendations, that you start with a negative pressure room for aerosol generating procedures, if not to use a regular positive pressure room or a single room that's neutral, and then use a HEPA filter. If not, just wear that 95 in a single room.
Thank you so much, Dr. Leila. We have a couple of questions for Dr. Tamer. The first one is, I want to ask Dr. Tamer that according to him, when are the numbers going to drop in Saudi Arabia?
Yeah, thank you. That's a very, very important question. I think we all have that question in mind. However, as I said, it's very difficult to predict. We can predict the number of cases according to how the virus is behaving right now. However, to be able to know the numbers later on, it depends big time on how do people behave. Yani, if people abide by the social distancing and they still protect themselves, that the numbers definitely gonna go down. And again, as simple as that, if you don't meet someone who might be a potentially infectious, you're not gonna get the infection. So if everybody applies this rule, then the numbers definitely is gonna go down. However, if that is not the case, and this is the problem when like a small group of the population does not abide, that's probably going to affect the population as a whole. But with the measures that the ministry have taken, I think things are going to get better. We're identifying more cases, as you saw in the numbers. Every day they're announcing like more than 1,000 cases. Most of those are being picked up as part of massive screening, which means that most of them are even asymptomatic or having mild symptoms. So those people are being quarantined, are being isolated, and they don't spread the infection. So that's a good news, which means that hopefully, inshallah, numbers might improve. However, again, as I said, if we don't, like as a whole community, abide by the regulations and the social distancing and hand washing, things might go in the other direction, God forbid.
Thank you so much. There was also another question before we go to the next speech. There was a question about whether the recovered patient from COVID-19 can recontract the virus again.
Yeah, another very interesting question. Again, unfortunately, we don't know for a fact as of now, but it depends on how is the level of their antibodies and the immunity. Is it going to wane? Is it going to wane quickly or not? We have seen few reported cases of people that they have contracted the disease again. That's probably not very likely, but again, we can't really tell at this point if people who have contracted disease, if they can be reinfected or not. Some of the viruses, as we know from history, some of the viruses does have this capability, and some are not. Chickenpox, for instance, if you get it once, you're gonna have antibodies for the rest of your life, and you're not gonna get it again. However, for some viruses, no, you still can get it, or a different strain or whatever. So for these viruses, we don't know yet. There are reports, but from the numbers, it looks like at least in Saudi, we haven't heard about anyone who recontracted the disease or having had the disease again after being recovered.
تمام، يعطيك ألف عافية دكتور. في عندنا سؤال للدكتورة ليلى. Sorry we keep bringing you back، بس في سؤال متعلق بحاجات جهزتيها حضرتك. في شخص شاركنا بأنه his or her anxiety level is related to being or not being able to protect their homes. So I think you've had or you prepared some slides regarding how to prepare your home to be safe.
Yes, well, that's a very important point. And I would say I'm a mother also, and I do have kids, and I share this anxiety with you every day. But I would say that once you break it down a little bit and think about what is actually causing your anxiety, this will actually help you. Now, if you're worried about bringing the virus home, first of all, understanding that this is a very mild disease in 80% of people, that will be very helpful for you. Well, is that are you worried about transmitting an infection to a vulnerable person at home? That's a different setup. So what we try to do or try to say to most of our trainees and to our staff is that if you actually adhere to the common sense related tips of personal hygiene, you're always fine, because eventually this virus, as Dr. Thamer mentioned, the infectivity rate of it is not that high. And ourselves, we've been through multiple exercises in our institution, and we ended up doing multiple mass screenings. And the ability of that virus to really transmit within an institution is pretty low if you, and I really stress on this fact, that I follow my statement with the word if, because if you wear the mask, universal masking, in clinical areas, if you wear the personal protective equipment in a proper way, if you dispose them or don them or doff them in a proper way, the idea that you will encounter the infection is very low. Now, how after all of that you can create as another layer of protection to your home is by doing what we talked about at the end of my session, is how to actually make sure that the high touch areas and the most that you could have infected yourself with or transmitted the virus on the surface, including your clothes, your lab coats, your bags, your keys, your shoes, and so on and so forth. So these are the ways that you make sure that you disinfect them before you touch any of your loved ones at home. That's probably the best way to go through it. Now, another things that we can cover based on this question that I didn't go through for my is some of the cleaning and hygiene tips to protect against COVID-19. So there are a lot of things that already بطبيعتنا بديننا بوضوءنا يعني بأشياء مرة كثيرة, we do it every day. It's a muscle memory to us, but sometimes we don't really think about it so much, but we need to re-emphasize on them in a different way. And it's interesting that we're saying at this day and age that you need not to touch your face, and you need to not to cuff and sneeze into your hands, and keep your distance from others and wash your hand, though they are all common sense. However, this is something very essential, that you need to stick to your personal hygiene. Now, in terms of the home, like some of the very common questions I get is how to clean the home and what to do with the clothes, and how you keep your home clean. Just make sure that you modify it in a way that you include a disinfectant. So mainly the high touch surfaces, the doorknobs, the light switches, the handles of the commonly used drawers in your kitchen, or the surfaces that you put your stuff on. So these are the high touch surfaces. If they're dirty, first clean them with soap and detergent, and then use a disinfectant product that contains at least 70% alcohol or bleach. And these are available in all pharmacies, and that's very widely spread. It doesn't need to be of a specific brand. And just to make sure that these wipes or sprays need to stay wet a little bit on these surfaces. And then use the instructions that for these disinfectants, and use them as recommended. And for electronics per se, I feel like this is one of the points that we always miss. Our phones are actually like full of all the hospital germs. So if you can have them in wipeable covers and disinfect them periodically, whether using these electronic device wipers, or even like the regular wipes on these devices, that would be actually advisable. And in terms of the clothes, I don't think that you need to do anything differently. It's just be cautious and do common sense. Just clean your stuff very regularly. Like if you think that you wore a scrub suit that was heavily used in a shift, that you may have been in touch with the patient, just don't shake them. Put them immediately in a disposable bag. Laundry them separately. Use the warmest appropriate water setting and dry items completely. Wash your hands when you touch them, and so on and so forth. So there isn't something really specific for this virus apart from common sense, in my opinion. And then this is a very common question about food, and what do you do with food delivery services, and what do you do when you come from the grocery store, and so on and so forth. So I am one of the folks that I think if you wear a glove in a grocery store, that you're actually kidding yourself, because the idea is that you think you're protected and you're actually not. I would prefer if you just wear the mask and frequently perform hand hygiene with a hand sanitizer. That would actually be more protective. However, if that makes you less anxious, you need to make sure that you're not touching other parts of your body with your glove, or not touching the front of your mask and then touching your eyes or rubbing your face, and so on and so forth. So, what the things that we can actually advise about is just the regular food packaging and handling precautions. Remove the packaging, dispose them in waste bins, and put them in put the food in a secure way. If you're taking takeouts or deliveries and so on, just place them in clean plates and dispose the containers. Wash the unpackaged produce and wash your hands afterwards. So these are like general tips. And the exercise that I had to go through before going into this whole thing about 7 or 8 weeks ago, when we first started preparing for seeing patients with COVID-19, I remember my conversations with my family members about, okay, so I'm gonna go see these patients. I have kids at home, I have vulnerables at home, so how we can do this in a way that we can make sure that I do my job and not infect you. So by doing that, like, we had a plan of, okay, when I'm really going into this very hardly, this is plan B, the kids will go there, this is the room where they would sit, and this is where I would do X, Y, and Z. So that really helped, that when I go through this process, that I go through without really being anxious. And we had that discussion. It's just so interesting that that's where I got to know my neighbors, because it's actually very fun. Living, I just moved into this new space that I didn't know my neighbors, and until the setup where I said that, no, this is the time that I need to know my neighbors, and I need to tell them that I'm a healthcare worker, and if my family needs anything, that you probably may need to pitch in, and so on and so forth. So these are like general tips that I use and I found very helpful for me. They are not meant to be a guide for anybody. However, like, I feel like a lot of my trainees were happy to share this, and I feel if it's going to help anybody, that would be something that I would love to share. So I also had some supplies of face masks at home. I had some like long-term non-perishable items at my home. Something about like having a habit of just having a specific time at night to just check what's happening and be aware of my local setup, and arranging a space for work at home, because if you really care about this, you need to really buy into it and really do the social distancing rule. And if you have to continue working, you need to continue working, and being at home doesn't mean that you stop working. So finally, I think my last tip is that you need to touch base with others, your family members, especially the vulnerable ones, and create a system that you check in with them every now and then. Because if you can't visit them, at least you make sure that they're fine and their needs are actually fulfilled. Otherwise, things may slip and fall through the cracks, and you'll be the last one to know because you're busy with your work, and that's not what you really want to do. And then finally, take care of your emotional health and your household members. And I think this will bring us to your I think that's all what I have for now.
I would like for you to stick with us for one more question. We have a special question asking about. I'll have to ask it in Arabic. We have someone asking about whether wearing a niqab is enough. Does it function as the mask? And if not, can they wear the mask under a niqab or not?
Well, that's a very hard question.
We say the special questions to you.
All right. Okay. So let's say that, okay, for a facial cover, like a cloth, like if you're going outside and you really don't want to have a exposure, I think the cloth in itself have been promoted as a potential way of actually protecting yourself from like a widespread in a community. However, in a healthcare setting where you're going to actually perform a health encounter, where you are actually going to examine a patient, be close to a patient who may or may not either suspected or confirmed COVID-19, the niqab is not enough. You need to wear a mask. Now, there is, I'm not quite sure about literature of saying about what's front and what's back and what so on and so forth. But again, practicing common sense, and I disclaim that I'm really saying this out of common sense philosophy, that I am against wearing the mask under or over. I'm actually promoting for removing the cover or the cloth and just removing it up and then wearing the mask. You can't continue covering the upper part of the body of the face with the upper part of the niqab. But the whole idea is that what I don't want it to happen is that if you wear the mask on top of the cloth, you're not performing a good seal. So actually and when you remove it, or the patient, let's say, coughs in your face, and part of it comes into that cloth, and you remove that little face mask off of it, the particles are already on the same cloth that you're putting in front of your nose. So that's where I worry. Now, the other thing is that if you wear it under and you maintain a good seal on your face, but the first encounter with the patient is actually your face close through it again. So in my mind, like, I feel that this is actually kind of like not doing the job in no way. So if you are really going to see a patient and going inside a room and examining a patient, you can just lift that little, keep your upper part of the face covered with the niqab, and just wear the mask properly. If you have the proper seal from the top of the nose until below your chin, it's technically covering your face as if the face cloth is covered. So you're not changing any of your look in a way, or any exposing any part of your face, to be honest. But all what I care about is that just make sure that you don't touch the other parts on the niqab and then put it back on your nose. So again, it's not what to wear, it's just how to wear it and how to remove it, what matters. Because make sure that you perform hand hygiene before you lift that piece of a niqab, make sure that you perform hand hygiene before you lift it back, and so on and so forth. So I'm not saying لازم واحد يوسوس ويفكر كثير, لكن some stuff just need common sense about how to protect myself and how to make sure that I do things properly. هذا اجتهاد على فكرة. I have no basis to this. بس هذا اجتهادي الشخصي وهذا وجهة نظري الشخصية. أعتذر إذا أحد عنده رأي آخر. I don't know. Dr. Tamer, do you have any other comments?
Yeah, if I may say just a quick one. يعني دكتورة ما شاء الله ما قصرت. she covered it very nice. فإذا تسمحوا لي أجاوب هذا السؤال بالعربي since it's النقاب وكذا. So again, the short of it is you can تقدرين تلبسين النقاب في الببليك في المجتمع في الكوميونتي برا as a barrier كأنه ماسك قماش ما في مشكلة. المشكلة في النقاب إنه الفرونت of it is going to be contaminated وما يتغير زي الماسك. لكن it's not a replacement في الهيلث كير سيتنج. يعني لما تشوفين patient أو تدخلين على patient COVID suspected or confirmed الماسك النقاب عفوا is not an option. You have to wear the mask الappropriate حسب السيتنج الموجوده بالطريقه اللي يعني الصحيحه بحيث يضمن يغطي الوجه بالشكل اللي تبغينه. بس انه ما هو بديل للماسك في الايزوليشن رومز، لكن قد يكون بديل مناسب انه كحاجز كبارير. لان الناس الان قاعده تتكلم على الماسك القماش، النقاب از ماسك قماش يعني باختصار. ف that's the short of it if I may add.
Thank you so much. I think we will move to the next topic, which will be covered by me. I was relieved to begin with after this pandemic started, because I started collecting data from trusted resources, and now I even feel more relieved getting those information, and I hope that a lot of the audience are feeling the same too. We'll get to know the answer by the end of this webinar. My name is Maha Al-Maharib. I'm a senior clinical psychologist, and I'm a member of the Consultant Advisory Committee for DAM at Saudi Commissions for Health Specialties. Today, let me just share the slide. All right, can you see my slide? Can you see my slide?
Not yet. No,
Not yet.
Did we lose her? Ms. Jihan?
طيب تبغى نجاوب بعض الاسئله قبل ما ترجع الدكتوره معها؟
I think she's back.
Perfect.
Ms. Maha, I think you're on mute.
So I think we're good to go now, right? Can you hear me?
Yes, go ahead.
Okay, great. So this was not planned, and I could have took the chance to panic and get really anxious, because I'm anxious by nature, but I will not, because I perceived it as a threatening situation. It will make my presentation as a failure, and quickly I went through the coping strategies, either to freeze and panic or to look for solutions. So I connected the internet, I switched the internet to using my cell phone internet, and that's what we called coping skills under situations that we call threatening or stressful. So this happened by chance, and I hopefully it will be, you will see the connection between this example that happened live and what we're going to talk about just a few seconds from now. I'm talking about perception. In terms of psychological preparation for this crisis or pandemic, I would like to start with two quotes. There are things known and there are things unknown, and in between are the doors of perception. When you can change your thoughts and perception, you can change the way you live. The example that happened to me just a minute ago, the internet disconnecting, could have led to two circumstances. Either me panicking and becoming upset and being stuck for 10 minutes, or shifting my perception into the coping strategies which were accessible to me, and connecting and fixing the problem and carrying on. Here, the distress was gone because I found the solutions that were accessible and healthy for me. Your perception of the pandemic matters. Your perception of your ability to handle the crisis matters. When we face crisis, for us, we look at them as either things that exceeds our ability to handle, or things that we can handle. When we look at situations at things that exceed our ability to handle, here when we become stressful, here when the stress become negative, and we want to look at how we can evaluate our perception to make the outcome smoother on us, especially on this crisis. Why are we discussing the power of perception? We're discussing the power of perception because Keller and his colleague has published a study in 2012. They tracked about 30,000 adults in the United States for 8 years, and they asked them how much stressors did they have in their lives during the past year. They did ask them whether they believe that stress is related or could cause them health issues or not. And 8 years later, they found out that people who reported that they did have stressors within the past year, and that the same group that reported that stress is related to health related issues, they found that they had increased risk of dying by 43%. And that was only for those people who also believed that stress was harming to their health. I hope this can capture the importance of your perception, my perception, our perception during this crisis. How are we perceiving it? Are we perceiving it as something we can handle? Are we perceiving it with something that we think the resources we need are available? Or are we perceiving it as a threat that exceeded our ability to handle, and then we're experiencing negative and devastating stress? We want to look at the other slide. I hope I can. Okay. So when we usually, as I mentioned just a minute ago, when we usually face stressors, and we're talking about a pandemic at this time, usually you choose consciously or subconsciously whether it's a challenging crisis or a threatening crisis. If your perception looks at it and evaluates it as a challenging crisis or situation, the potentials usually will be leading to personal or career growth, and there will be gain. If we perceive the crisis or the situation, the pandemic or whatever situation we're facing is as threat, this might lead to harm, loss, or negative consequences. Why does that happen? Well, I want to show the end of that. Okay. Why does that happen to us? when we think that we don't have sources for us to cope well, when we think we don't have sources around us to protect us, to teach us, our threat levels will be high. That's why we all gathered here with the infectious disease specialists to teach you about very major and important pieces of information that could save your anxiety level or levels greatly. We want our resources to be identified from the beginning of identifying a threatful situation. By saying that, I mean, once you face a situation that you feel threatened by, meaning you feel that your ability to handle it is lower than the situation itself, mark your map. Make sure you have resources to reach for a scientific-based method, and stop getting the information from WhatsApp groups or non-trusted resources. Make sure that you have your resources to reach out for psychological support, such as DAIM program. DAIM program is now providing hotline services through 24-hour services for all healthcare practitioners. And you can apply through Dr. Saud Al-Omar will show you the application process by the end of this webinar. It's a very easy process. All of us mental health care practitioners are available for you 24/7 through DIME program to help you and walk you through any struggle you think you might be having. We are here to guide you through finding and identifying the mental health related resources that would work best for you. When it comes to coping skills, when it comes to therapeutic techniques, when it comes to crisis management, it's a not one size fits all. So if you try one method that you read about or you heard about and it doesn't work for you, that doesn't mean it's wrong. Maybe it doesn't work for your personality. So I encourage you highly to reach for services, especially for DIME services. I'm not advertising. I'm talking about DIME especially because I'm part of that family and I know how qualified the members are. I know they're very available 24/7, and I know they're ready to manage any kind of psychological crisis at any time of the day, and provide you the coping strategies that fits for your personality by evaluating the problem. So, is COVID-19 making you feel threatened, anxious, stressed, out of control? This is all expected. And I want you to be sure that your feelings are so validated. If you're not feeling anxious, if you're not feeling stressed out, if you're not feeling tense, this is what I would call abnormal or unexpected. So if you're feeling this is what most people are feeling, or most healthcare practitioners are feeling during this crisis. You are not alone. Early prevention will prevent you from reaching later stages where mental health disorders usually grow, burnout, and other chronic stress and other factors that we started this program so no one reaches the later stages. I want you to focus also on the unhealthy daily practice. I cannot see. Oh. I want you to focus on modifying the unhealthy daily practice that increases your anxiety and also that tells you about your perception. When we look at this picture, this is from today, evaluate yourself. Do you usually look at the number of deaths, the number of losses, or do you usually look at the number of recovered patients? And you can go from there. If you usually focus on the number of deaths and number of losses, that could tell us that your perception of of the crisis is threatened related or threat related, and this is related to distress, which is the negative stress. Are you looking at the number of recovered patients? This is what I personally try to look at. I set limit to myself. I set boundaries to myself as a mental health practitioner. In terms of news, I will review the news at least 1 time a day, maximum 2 times a day. And my sources will be the trusted sources like the Ministry of Health or MOH, any 2 top sources, make them yours, and avoid the WhatsApp group videos, the fake videos that doesn't reflect anything scientifically based, and it only works on increasing your anxiety. Anxiety and fear of the unknown. When we're anxious because we don't know what's going to happen. We are worried about the unknown part. We tried to make a lot of the unknown based on our clinical observation with a lot of frontliners known today by having Dr. Leila and Dr. Thamel covering the proper prevention techniques, covering steps on how to prepare you to be safe at home and at work. So make the unknown. If you're worried about what if I carry the virus to my house or to my kids, or to make sure you follow and go back to what Dr. Leila talked about in terms of protecting your home, and follow those instructions. Make what you're afraid of clear to you and have a plan for it. If you're worried about getting the disease at work, follow the instructions written and explained by Dr. Leila at work or in the workplace. Once you feel safe, your perception will work as if the possibility of getting or if the risk of getting the virus is lowered. Why lowered? Lowered because you're taking all of the precautions correctly, taking it from an evidence-based specialist. So that should help a lot of the anxiety to be decreased over time with the correct practice. We also say make the unknown known. We usually fall under the thinking, what if, what if, what if. Put all of the scenarios, write them down, put the worst case scenario, and identify your actions if any of those scenarios happen, but make sure the scenarios in your mind are realistic. So don't make up scenarios out of exaggeration that's usually associated with anxiety. Make the scenarios that could or possibly happen in your workplace or home place, and try to have an action plan to respond to them. We only have 2 minutes. We want to leave them for Dr. Saud. Always remind yourself why you chose this profession. You chose this profession because you're brave. This is a crisis. Alhamdulillah, we're in a country where we don't face a lot of crisis, but it's a crisis that came all of a sudden. We were not prepared. That's why we're struggling, but we will get through it. We will succeed all together. You have all the channels to reach medically and psychologically. So don't hesitate to reach out for help as early as possible. Thank you so much for listening, and I will leave the speaker to Dr. Saud so he can cover a few points about Da'im services. Hopefully this was helpful, and thank you so much. I appreciate every single effort you do.
Assalamu alaikum wa rahmatullah. Thank you, Maha. Thank you all our great speakers. I am Dr. Saud Al-Umar from Da'im team. Do you hear my voice? Is it clear?
Very clear.
Okay, great. Just I will take you through the application process of to apply for DAM. DAM, as Maha said, it's a psychological support for all healthcare providers. It is a confidential and free of charge. It is free for all healthcare providers. It is just for psychological support. I will share the screen with you. Just I'm trying to. Can you see it now? Is it clear to you all?
Yes.
Yeah, okay. So you go to Saudi Commission website, then you can go to e-services. Then when you go to e-services, you apply to healthcare practitioner. Then this web will appear to you, or this page will appear to you. What is DAM? We are here for you. And more about mental health, which is like some brochures and pamphlets. So we go to click on this one. We are here for you. Then it will take you to this page, how to apply for the services. You have two ways of application, either calling the free call center, which is 9200-19393. Then you choose the proper extension. I think it is number 4. They are answering for all calls from 7 a.m. till 5 p.m. Or the other way, to go through this website, which is like 24 hours. Then you can select either you are a practitioner or a trainee. Once you select the practitioner, you have to enter just for verification, identify your number and registration number and your Iqamah or Saudi ID. Then it will take you through like a screening question. After that, you would receive a message, either both SMS and email, that your application has been approved. Then it will also be transferred to the counselor or the healthcare, the mental care provider. Then appointment will be sent to you to set the appointment to be called either through phone or by Zoom. This is briefly and simply how to apply for DAM services. Thank you all, and thank you, Maha. I leave the mic for you. Thank you. Maha, you are on mute.
Sorry. Thank you to all of you, to each of you, for what you do. I know some of you have mentioned that sometimes you get comments from friends that are afraid, getting away, avoiding you for some reason because they're scared of the virus, probably, but not you. It's not personal. We are proud of you. We are proud of what you do on a daily basis, and we are here for you. This was initiated for you, and I would like to thank the speakers for this wonderful speech. We've needed such scientific, smooth speech on basic information that I think a majority of the healthcare practitioner needed. I enjoyed every single minute of this webinar. I benefited myself from the consultants, and I would just like to thank you so much for your attendance, and hopefully we'll see you again.
Thank you very much all.
Thank you all.
Thank you all.
جزاكم الله خير والله يكتب أجركم إن شاء الله.
يعطيكم العافية جميعا.
السلام عليكم.
السلام.